as we are joined by Paul Seegert, managing partner at PCS Advisers and a healthcare consultant. And Paul, thank you for being with us tonight.
Thank you for having me.
Now then, I am told that the odds of being struck by lightning in a given year are about 1 in 500,000, or that is to say, you are, by the statistics of what we have heard, and again, the causality issue is open, you're about twice as likely to get hit by lightning than you are to develop a blood clot from the Johnson & Johnson vaccine. So I think we should keep this in some perspective.
Yeah, I would agree with that. And we're a little bit behind Europe in using this style of vaccine, the AstraZeneca vaccine that's in use over there. They've had 86 such events, so quite a bit more has happened there, but still a very small percentage of people are affected in this way.
Yeah, important to keep in mind. Do you think this will have an impact on the future development of vaccines? That is to say, this actually uses actual virus. Do you think this is likely to move researchers away from that as a source of future vaccines?
Well, yeah, it's an interesting point. We've got two types of vaccines that have been approved for emergency use, the mRNA vaccines, which are the other two that are not paused, and then these viral vector vaccines. Both of those are newer ways of building a vaccine. In the past, the old vaccines that we used for polio or for the measles and that kind of thing were weakened versions of the actual virus or deadened versions of the actual disease. And so the idea of using a virus as part of the vaccine isn't new. The way they're doing this one is where they're taking a kind of an innocuous virus like the common cold type virus, and they're pulling out the genes that create the spike proteins from COVID-19, which is what your immune system responds to get these antibodies going. They're putting those genes, they're splicing them into this weakened version of this other virus, this harmless type virus like the common cold, and then they're injecting that into a person when they're getting vaccinated. Those then go into your healthy cells and produce COVID spike proteins that go out into the body and then encourage an immune response, and you get the antibodies, and so it's a new style or a new technology, and there's a lot of hope around it, or at least there was prior to these events. I think there probably still will be a lot of hope around it that it will offer the opportunity to cure or deal with other diseases as well in the same kind of way.
Mm-hmm. 1-866-50-JIMBO, our number, 1-866-505-4626. Of course, we're faced with another factor in this particular case, in that there are those people who apparently are looking for any excuse not to take this or, for that matter, other vaccines.
Yeah, we've got vaccine hesitancy in general in this country. About 30% of Americans, when it comes to any vaccine, unless there's a fair amount of pressure, like getting your kid in school or something like that, they do not want to take vaccines. It's even higher in Europe. And now with COVID vaccines and how quickly they were developed, we've dealt with even more hesitancy. And I was looking at a report earlier today of how that's trended each month from December, January, February, and March, and there's progress that's been made in terms of winning people over. It was up north of 40% in December, and now when you look at it in March, we're at 13% that will definitely not take it, 7% only if required, which will it ever be required? I would say probably not, and then 17 that are in the wait-and-see category. I'm thinking we're going to see the wait-and-sees go up a little bit after the news we had today.
It's been hundreds of years since vaccines were first used, and they work. I mean, different levels of effectiveness, but again, I've never fully understood what was going on in that regard.
Yeah, I agree with you. It's from a public health standpoint, there's an acceptable amount of side effects or percentage of side effects. The old polio vaccine that was an oral dose, single-dose oral vaccine.
Right, and before that, the inoculation, which is the one that I got, the Salk vaccine.
Mm-hmm. Yep.
And I got that at a time when kids were, when a neighbor kid of mine got got polio, we were forbidden to get within 100 yards of the kid's house, for Pete's sake. I mean, people don't understand. People don't remember the polio epidemic, and that affected far fewer people than this. So anyway, I see your point. Let's take a call from Gil in Manila, the Philippines now. Good evening, Gil.
Hello, Jim, and to your guest. As I've mentioned several times, we have a clinic here run by the U.S. Department of Veterans Affairs. And I was notified yesterday that I was going to be vaccinated probably sometime in the next 10 days as soon as the vaccine arrives. And we were anticipating the Johnson & Johnson because it's a one-shot process, and they're going to have to go out into some of the provinces to vaccinate older veterans who can't come here. With this new development around Johnson & Johnson, it doesn't seem to affect older males like myself, but I'm wondering how that might affect the future use of the Johnson & Johnson vaccine.
Well, we should note that the Food and Drug Administration is now recommending a pause in the administration of the Johnson & Johnson vaccine, and I'm not sure just how mandatory that is. I mean, I didn't get mine out of a federal facility at all. I got mine out of a drugstore. My wife got hers. I got the Moderna 2-shot. My wife got the Pfizer 2-shot out of the local hospital. As far as I know, the feds didn't have a lot to say about that, but I'm not sure. Maybe Paul Seegert knows. In regards to when the FDA recommends something, does that carry a lot of weight with local hospitals and pharmacies?
Well, I think there won't be many lining up to take it, and so it'll kind of moderate itself in that way. But really, ACIP will be meeting tomorrow, and that's the organization that informs the CDC on what the guidelines should be. But they really are guidelines. So it could be that people still get administered with the vaccine. They're projecting that this will be a pause of maybe days or as long as weeks. So it's not likely to be a really long pause, would be my guess. And that's pretty well supported by what's happened in Europe with their similarly designed vaccine, the AstraZeneca vaccine over there. They had many more events because they distributed much more of this type of vaccine, 86 of these clotting type events, and they determined that it was more likely in women who were younger. Now, that isn't certain. A lot of the folks that were favored in the beginning of the vaccine rollout were healthcare workers who tended to more likely be female. So that could sway that. But it's interesting to see how each country is dealing with it in terms of how they're recommending moving forward with it. They've generally have gone back to using this style of vaccine, but in the UK, as an example, they're not recommending it for people under the age of 30, and in Canada under the age of 55. So we may see some of those kind of things happen here.
All right. More calls to come. 1-866-50-JIMBO, 1-866-505-4626. Paul Seegert, our guest. He is with PCS Advisers.com, and we'll be back with more in just a moment.